All right, so this is the question. What are the 5 most common mistakes a doctor makes when they're talking to a patient about stem cell therapy? Number one, and it happens to every patient that we see, that they talk to their physician about stem cells and the doctor says one of these 5 things, and all 5 of them are wrong. Number one is it's banned in the US. That's not the case. Bone marrow aspirate concentrate, autologous cell therapy, is very common procedure in the US. It's been used in spine surgery as a common part of the surgery for a really long time. And in our clinic, it's the bone marrow harvest catheter that I developed as part of this bone marrow aspiration kit has been used for more than a decade. So it's not banned, number one. Number two, there's nothing published on stem cells. My favorite, and if you look back at one of our previous episodes where I just went through a lot of the literature, people say, well, there's nothing published. There are over 6,500 publications just with bone marrow aspirate concentrate, just using the centrifuge that we use, that has shown dramatic results. There hasn't been a downside published. There's no rejection of the tissue. It decreases the risk of infection in every instance of every paper published and dramatically changed the outcome data if it was used for something appropriate that made sense. So certainly when someone says there's nothing published, you can't go to Google, Bing, and Yahoo. You got to go to DuckDuckGo, Brave, or a Tor server, or better, Google Scholar or PubMed, 6,500 papers. So when someone says nothing published, that's just not true. A lot of this literature goes back to the late 90s or before. The third one is that, well, it's only legal in other countries. No, if we're talking about umbilical cord stem cells that are isolated and cultured, that's not legal in the U.S. to culture postnatal tissue graft. Is that the only thing that is a stem cell? Certainly not. It's not autologous. Do I think that that's dangerous? No. I think there are great ethical uses of postnatal tissue graft in the U.S. Another common mistake is when a physician is talking to you about cell therapy and they're talking about PRP. If it's taking blood from you and they're telling you it's a stem cell injection, that's not true. PRP is platelet-rich plasma, means it's blood. They need to be, even with PRP, it needs to be real PRP, which means it has to be 5 times more concentrated than whole blood, which means it has to be centrifuged and treated appropriately, not some little office-based centrifuge. And if you're taking 10 cc's of blood from someone, that's not even real PRP. It needs to be 60 cc's of autograft, your blood, spun down. Do I think PRP is bad? Absolutely not. I think it's an inflammatory construct using platelet that you can inject that can help provide and provoke healing for a patient. Is it a stem cell injection? No. If someone is telling you PRP is a stem cell injection, that's not correct. Number 5, and my absolute favorite argument against stem cell therapy is they're killing babies. First of all, that has never been true with the use in clinical medicine in the United States. There is no way that I would want fetal stem cells to treat an adult condition, whether it's autoimmune related or whether it's musculoskeletal or cosmetic related. Those cells are trying to grow a baby. That's never been true. Even if it's talking about umbilical cord or postnatal tissue graft or amnion, those cells are from ethically sourced, donated placental tissue. It's the use of afterbirth. Are those cells ever involved in the killing of a child? No, because that would cause platelet. There's a lot of medical reasons for it, let alone ethical reasons. Number one, I have 3 daughters. It's not in my moral compass to harvest fetal tissue graft for a cosmetic or musculoskeletal or pain purpose. And it's not needed. The patient's own cells from bone marrow or ethic, or even if it was legal, or to talk about, do I think postnatal tissue graft cells have ever involved the use of killing a child? No, those are fetal mesenchymal stem cells. They don't really have a medical purpose unless you're trying to grow a baby, or unless you're big pharma wanting to experiment on cosmetics or drug therapy. There's not a clinical use of those cells indicated in the U.S. to treat what we would treat or use stem cells, bone marrow aspirate concentrate, in the U.S. for. So again, those 5 reasons, PRP is a stem cell. Not true. It's not bad, but it's not a stem cell injection. Number 2, they're banned in the, no, you don't ban the use of bone marrow aspirate concentrate. I'm taking your cells, concentrating them, and kind of putting them where they need to go to help you heal better. Number 3, it's only legal in other countries. I don't even know of another country I would want to travel to have my bone marrow harvested, let alone spun, treated on a field, and then injected back into me to make sure it got in the right spot. And the last one, of course, is killing babies. And that couldn't be farther from the truth. And it's never been part of the science. It was a smear that they used to get ahead of the narrative to make us stop talking about helping you heal, which is what the stem cell does. Whether I harvest it or whether I create a wound on you, your body's going to heal the same way. It's going to mobilize those cells to help you obtain better healing. I should be able to help push you in that right direction by concentrating those cells and kind of putting where they go. Again, those are the 5 common mistakes when you talk to a physician about stem cell therapy that couldn't be farther from the truth. I'm Dr. Wade McKenna. This was brought to you by the Zero Downside Podcast. As always, sponsored by MoabTexas.com. Please hit the like and subscribe button, and thank you for your attention.